Today, we're going to see how doctors basically become detectives. And it all starts with just one single clue: trouble swallowing. We're breaking down the entire step-by-step investigation of what's called dysphagia. And it's all based on a classic text, a manual on clinical surgery. I mean, think about it for a second. You swallow thousands of times a day, and you probably never even notice. But what happens when that simple, totally automatic action just stops working right? All of a sudden, something you completely take for granted becomes a huge medical mystery. So the medical term for this is dysphagia. And it's important to note, it's not a disease itself, it's a symptom. You can think of it like the first clue that kicks off a full-blown investigation to find the real culprit. So let's follow the evidence. So where does an investigation like this even begin? Well, it's not with some fancy machine or a complex lab test. Nope, it starts with a conversation. The first, and maybe the most important step, is simply listening to your story. This is where the real detective work kicks in. A doctor isn't just asking random questions. They're piecing together a timeline. How did it start? Does it hurt? What else is going on? Every single answer helps them narrow down the possibilities and cross suspects off a very, very long list. And just look at how these three key symptoms can point in totally different directions. What comes back up, for example, tells its own story. The timing of a cough can be a huge clue that food is going down the wrong pipe. An unexplained weight loss? Well, that's always a massive red flag that something serious might be going on. And you can see here just how specific this all gets. Acidic stuff coming up, that points to reflux. A cough the instant you swallow, that could mean a tracheoesophageal fistula, which is really just an abnormal tunnel between your windpipe and your food pipe. If the material smells foul, it suggests the esophagus is stretched out. And that weight loss we mentioned, it could be a sign of anything from achalasia, that's a nerve issue that basically paralyzes the esophagus, all the way to esophageal cancer. The patient's story really does hold all the critical clues. Okay, so after getting the story, what's next? The physical exam. This is where the doctors start searching for clues on the outside of the body that can reveal what's really happening on the inside.
And as you can see, this is an incredibly thorough, head-to-toe kind of examination. I mean, the list is long, but they're looking for everything. It could be something really obvious, like a swelling in the neck, or something way more subtle, like an issue with the spine that's maybe pressing on the esophagus. Every single part of the body is a potential source of clues.
But some of the clues are, they're way more subtle and surprising. Take this one, for instance. What on earth could the shape of your fingernails possibly have to do with having trouble swallowing? Well, it turns out a whole lot. That spoon-shaped nail, especially when you see it along with a smooth, pale-looking tongue, is a classic sign of something called Patterson-Kelly syndrome. And that's a condition where a severe iron deficiency actually causes these thin webs of tissue to grow inside the esophagus, blocking food. It's just an incredible example of how a problem in one part of the body can show up somewhere you'd never, ever expect. So once the history and the physical exam have given the doctor a working theory, it's time to confirm it. The next step is all about using technology to get a direct look at what's going on inside. And these investigations, they follow a pretty logical path. They usually start by taking a direct look inside with scopes. If that doesn't give them the answer, they move on to imaging, like a barium swallow, which lights up the entire passage on an X-ray. From there, they can get even more advanced, maybe measuring the muscle pressures with manometry, or getting a super detailed 3D image with a CT scan. Each test just builds on the last one. So, now we're at the final part of our investigation. This is where you put all of these clues, the story, the physical signs, the images, all of it together to finally arrive at a specific diagnosis. This final stage is all about pinpointing the exact location of the problem. And as you can see from this list, the cause could be anything from simple tonsillitis in the mouth all the way to something like a retropharyngeal abscess. That's an infection behind the throat that's pressing on the pharynx from the outside. Each location has its own unique list of suspects. And this slide right here perfectly shows why those tiny little details from the beginning are so critical. Just compare these two serious conditions. In achalasia, where the esophageal muscles don't work right, patients often find that liquids are actually harder to swallow than solids. But with esophageal cancer, it's the exact opposite. The trouble starts with solids and only later moves to liquids. Two very different diseases distinguished by those subtle clues that came right from the patient's own story. So, as we've seen, Figuring out the cause of dysphagia is really a masterclass in clinical investigation. It's this methodical process that builds layer upon layer, starting with the patient's own words and ending with a crystal clear picture from the inside. So, what does this all really teach us? I think it shows that in medicine, sometimes the most powerful diagnostic tool isn't $1 million scanner. It's the ability to just listen carefully. It's a powerful reminder that the body is this incredibly complex, interconnected system where the smallest clue, from the shape of a fingernail to the timing of a cough, can be the key that unlocks the entire mystery. That's all we have for this explainer. Thanks for tuning in.